In a world increasingly shaped by technology, the HumanUp Imperative explores the significance of human connection with each other, with the communities we serve, and perhaps most importantly, with ourselves. Join Rex Wallace and his guests as they discuss the ever-important role of authentic, meaningful connection in healthcare. It's time to Human Up.
Hey everyone, welcome back to the HumanUp Imperative. Happy New Year, Season 2. We're excited to be here. Hey, we don't usually put the words lobbyist and mindfulness in the same sentence, and that's really why today's conversation matters so much. My guest today is Gary Jacobs, a longtime healthcare lobbyist who has spent decades navigating, the power and pressure in D.C. while trying to persuade the outcome of some of the most important healthcare policies our country has faced. But Gary's story isn't just about policy, it's about presence. In his book, The Zen Lobbyist, Gary shares his journey that includes being a patient first, then a mindful patient, then a mindful advocate, and a deep belief that how we show up as humans matters just as much as what we're advocating for. I'm really grateful for this one. Let's human up with Gary Jacobs. Welcome to the show, Gary.
So happy to be here.
Hey, I'm so glad you're here. So real quick, Gary and I worked together for a time back. I don't even know how long ago it's been. A couple of decades ago, probably, right? Like 2007, 2008, something like that. And at the time where we worked for a health plan, we were big private fee-for-service health plan, so I had a lot of private fee-for-service markets. We were trying to evolve those markets into managed care markets, so replacing or evolving a private fee-for-service plan to PPO and then an HMO. And I was brought on to do a lot of the market analysis. So I was creating these reports for each market. So take York, Pennsylvania, and I'm creating these visuals that show maps of the market and member density and provider relationships and cost information. And I'll never forget, Gary comes into my office one day and says, "Hey, I'm a big fan of your work. I actually hang your slides on my wall and study them," right? Because he was our policy guy and doing a bunch of other stuff to help lead a lot of our efforts to evolve our company into these other product lines. And that's always stuck with me to this day. Whenever I'm creating a visual, if I'm creating a PowerPoint slide or an image for a LinkedIn post or whatever, if it's some kind of visual, I'm thinking, how can I make this to where somebody's going to want to hang it on their wall, right? Like how do I make it that meaningful to them? So it really stuck with me, Gary, that little
that's great
thing.
to know, Rex. Thank you.
So yeah, why don't you take a minute and do a little bit deeper introduction on yourself. Tell who is Gary Jacobs?
So there's an exercise in the book on who am I, and I won't go into that right now, but for the narrative of and this purpose, I'm a dad, I'm a grandpa, a husband, and I'm a lobbyist who is proud of being a courageous lobbyist that advocates for what he believes in and wouldn't do it unless he really believed in it. But most importantly, I have found that people are inherently good and really want to do good and want to do service to help each other. Once in a while, they get lost and they need direction to find who they are. And part of my mission over the last decade or two has been to help them repurpose themselves and refine who they really are so they can do the good work ahead that needs to be done. I can go on and on, but that's kind of really where we are.
Well, I read your book and I liked it a lot. Seriously, it was so great job. You do such a good job of through your journey talking about the history of Medicare, the history of value-based care, and all these important policies that came, but also your journey again as a patient and how you kind of got into mindfulness and then became a lobbyist, entrepreneur, right? Like it's you wear a lot of a different. You see it through a lot of different lenses, right? In the book, and I got to say, like the story about your mom and when you were a little kid and she made you watch this TV show to help you harness your superpower of creating big circles of friends. Like, I love that. I think that's such a cool story, and how she helped, obviously played a big role in helping you. I mean, that's a superpower of being a lobbyist, right? Is human connection with all these different people.
But human connection, to me, beyond just being there and, hi, I'm here, I have a check for $1,000 so I can come to your event and meet
Right.
you and talk about my issue. To me, that's very insincere, non-authentic, and lacks the long-term relationship that people are looking for.
Mm-hmm.
And the truth, if I may, is that most members of Congress, most members of state legislatures don't really know the issues like we know the issues because we live them every day,
Right.
and especially as complicated as healthcare can be. So when they find somebody that looks at the world through, and you probably got this from the book, but silence is strategy, compassion is influence, and gratitude is renewal. And you bring it to a member and they look at it. For a moment, they might look aghast and say, "What's this? This is not what I'm used to." But I am a human being. I do have kids, I have grandkids just like you do.
Mm-hmm.
I am aware of myself and my presence. And in that moment in time, you can connect with somebody in a way very unique and different than just transactional relationships. And I have sought those out. And if I have success in the work I do, which is hopefully good for all Americans, it's been that I've been that liaison between the truth of what's happening on the ground and how healthcare really works, and helping members understand that truth when they're making votes and deciding policy.
Yeah, there's an excerpt from your book that I think sums a lot of it up, and I'll read it quickly here. But you say advanced analytics, EMRs, and population health management tools can provide unprecedented insights, allowing primary care teams to be proactive, predictive, and personalized in their approach to patient care. But technology is just a tool. The real magic happens through human connection, by creating a healthcare model that values relationships, listens deeply, and treats each patient with dignity and comprehensive care. We can fundamentally change how we approach health. I love that. And I feel like that's sort of the summation of a lot of our discussions on this show too, is around, we have it's sort of generated from, even AI, right? We have all these powerful tools that are so helpful, but they are tools, right? It comes down to human connection. And you talk about it so well in the book. And maybe before we move into like your actual vision and mindfulness, like the book itself, how did this come about, and how hard was it to bring it into reality?
So if you jump on a spiritual quest to really connect with who you really are, and I can talk about that for hours with you, but if you jump on that little trip, or like in the book, I say about my band, the Grateful Dead,
Yeah.
long strange trip it's been. Yes, it has been. But if you are seeking, some connection to who you really are, then these things become natural because you begin to live in a world where, um, things get simple when compassion, again, is influence. Think about that as a concept.
Mhm.
Um, Compassion is just caring about one other person or one other being around you, your dog, your pet, your brother, your sister, whoever it might be, but being empathetic to and listening are just little powers that we all have but we forget because we get so caught up in our own narrative that we don't become our true authentic self. And in my journey, I've gone through health episodes, which I describe pretty clearly in the book, especially the anxiety and stress that led to panic attacks and things like that. Scariest moments of my life, Rex. But once I understood what the causal agent was and why that happened to me, and a path to recovery, if you will, or a path to find presence in my everyday life, it was a great learning lesson, and perhaps the greatest lesson I could have ever learned, because it made me better in everything I do, because I cared and I demonstrated it. I would smile just to give a gift of gratitude to somebody. I mean, it just changes your whole worldview. And once I was comfortable in my own shoes with that view, my sons, I have three, they'll say those things to me that I said to them as they were growing up, and they'll say, "Dad, I can't believe I'm now saying take a breath to my son, or slow down and be in the moment." It's a beautiful thing to watch.
Yeah.
But it just, for me, in the hectic pace of a life that I've chose to be an advocate and to be in a place where advocacy is all over the place, Washington, D.C., and live here, I needed to be rooted and grounded in being present in everything I did and to follow my own ethical course. And this is the path that I found, and laying it out in the book by citing examples of stressors that caused health issues, from panic attacks to blood clot to a stroke, waking up on a business trip and not being able to move my arm. I thought I slept on it, Rex. I didn't even
Yeah.
think about it. Went through my whole day, went through meetings, get to my office, and my admin goes, "Hey, Gary, we have to go right to the hospital." I go, "Is somebody sick?" She goes, "You are. Look at your face. You're drooping all over."
Oh, geez. Yeah.
I had no idea,
Yeah.
Rex. I had no earthly idea what. Called my wife. Next thing I know, I'm at GW Hospital, and they're telling me I'm having a stroke. I go, "Wow, it's a long day to have a stroke, huh?" So we spent 3 days in the hospital. I knew that the lifestyle of being that hyper executive lobbyist, and always being aware of, am I saying the right thing? Am I doing the right thing? Did I plan it enough in advance? Was getting me. No, it wasn't allowing me to be my best self. So in adopting the practices through my, I'll tell you the story of that if when you want me to, on how and why I made the connection through yoga, mindfulness, and meditation to find that balance that we're talking about.
Yeah.
Okay.
I've 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 done a little bit with it, right? I think I told you, like, before. I kind of got into it in 2018, 2019, started doing more mindfulness stuff, went to a yoga studio. And actually so in Gary's book, at the end of every chapter, there's an exercise that he, encourages you to walk through, right? So in one example, and this is the one that really resonated with me. I did all of them, but this is one I used to do a lot when I was meditating. It's a loving kindness meditation, right? And it just it really does open your heart up to yourself and to other people, right? And the whole point, the exercise is basically wishing good on yourself and on the people that are close to you, and then on other people, maybe people that are adversarial to you, or just the general population, right? Or your barista at Starbucks, right? Like some common person that you don't know very well, but you maybe interact with. But it gives you real humans to kind of practice this on, and it really does open you up So I love that you have those in there, and you do such a good job on. Yeah, so maybe go ahead. Let's dig into that then, and talk a little bit about mindfulness, and we'll come back to sort of how this plays into your vision too. But yeah, talk about the yoga aspect and how you kind of got into that.
So I am in South Florida, and a healthcare entrepreneur. And I think I was living in South Florida when I met you,
Yeah.
right? Something like that. So, in the craziness of everyday life in healthcare in South Florida, I eventually landed up in a neighborhood where my neighbors were two FBI agents, and their job was to investigate healthcare fraud.
All right.
And I owned a home health company at that moment in time. And guess what was number one for FBI investigating fraud? Home health.
It sounds like a Netflix
So,
documentary waiting to happen.
oh my gosh. So the craziest thing is one night they come by my house at like midnight during the week and they knock on the door. Sleeping, I get up and I see them and they go, Gary, we were doing a search of a company that you were involved with
Mhm.
and your name came up. No big deal. Everything was okay, but we want you to know that in case you get any phone calls or anything like that, because we do follow up on all things like that. So I let it rest, didn't really talk to them about it again. And then I get a phone call now about a year later, again at like 3 o'clock in the morning, and it's from the CFO of the franchisor of my home health company. So he tells me that the FBI just was interviewing him at his house till 2:30, and they wanted to know companies that used him, franchisees that used him as an advisor, and like, why did they do that? Was that double pay? Was he helping us manipulate things? So I said, thank you for that information. And again, it's quiet. And then I get another phone call from the FBI guys, and they say, um, we'd like to learn more about home health. Can you be an informal advisor to us? I said, wow, better be friendly with them
Right.
than be on the other side of that.
Yeah.
So I said, sure, I'd be happy to tell. Like in South Florida, a lot of um, patients in home health, you could buy a Medicare number, and that patient could be dead for all you know, and you could bill on that dead
Mhm.
patient until they caught you. Now, I'd say that most of the people didn't know this was happening, but there were obviously bad characters where it was
Mhm.
a part of their business. So the long and the short of all of that, Rex, was that getting enough of those phone calls triggers an effect that really gets you into fight or flight mode, and you start to lose your, grounding in my sympathetic or whatever nervous system, and I was out of control and I could not come back. And it it was very, very difficult to discern between real and unreal and all these things. And it wasn't, and that was so uncharacteristic of me. So I happened to meet, you go through the process, and doctors want to give you medication because it's the easiest way to do it,
Yeah.
including the psychiatrist. But I went through that process, and the medication was worse for me than non medication. So I needed an alternative way to think about this. I happened to meet an old buddy of mine who was the president of a local college in Fort Lauderdale called Nova Southeastern, which is now a big college, but it was very tiny at that moment in time. And he said, so I've been through a similar situation, Gary, and you should try biofeedback. And by the way, in our psych program, we have that, and I could recommend somebody to you. So long and short, Rex, is I did that work. It gets you very in touch with your body and with your reaction to stress, and you begin to understand it in a very different way. Long and just keeping going, and then now I'm back in functioning, and I'm pretty good. And I go to a conference with my wife in home health conference in Coronado Beach, California. And who's in Coronado Beach, but Deepak Chopra had just opened up the Chopra Center for Wellbeing. So I said, Stace, why don't we stay the weekend and see what this is about? Was a TM meditator back in the day. So I said, okay, Deepak was very involved with Maharishi Mahesh Yogi. Maybe this is good for me. So we went for a weekend. It was magical and felt terrific. And Deepak in that weekend was able to teach me that yoga wasn't necessarily just about practicing postures or asanas or just about breathing. It was a holistic approach to health and well-being that would allow you to function in your maximum potential in any given day. I said, sign me up. I love that. Got a new mantra. Deepak was teaching what was called primordial sound meditation. I embraced it immediately. It just connected with me really well. I went home and I was feeling myself in total again. I felt great. Went to my next biofeedback session and said to the psychologist, okay, I had enough. I now know how to heal myself. And this path of yoga, daily meditation, and being mindful in practice was my secret sauce. It worked for me really, really well. So that's how and why. And then I've lived my life through that ever since. Never stopped a day, always meditate every day. And it's become me. So when you say, like, who are you? Tell me your story. My narrative was kind of before that visit and after that visit.
I know you talk about Deepak in your book, and I just started reading, and I think you mentioned the book, and I think that's where I got it. I know you mentioned him, but the seven spiritual laws.
Spiritual laws. It would be my number one book to recommend to everybody, and every day read another chapter because it has practices.
And it's not long, right? It's so
not long
easy.
at all.
It's so easy to do. Yeah.
It really reinforced the practice to me on a daily basis. So it's very, very helpful in that way.
Good. Yeah, I just picked it up. I just started the first chapter, so but I'm definitely going to get through that.
You have to let me know when you're
I'm
done.
excited. Yeah, I will do. You say, and a couple of your quotes, you say, and this is sort of the end of a sentence, but believing that my focus needed to be directed to the future instead of the present is something you said. So you this is, I think, before maybe before you got into mindfulness, but you were so focused on looking ahead and not focused on where you are right now, like being present. And you say
probably the biggest learning I ever got was stop planning, stop thinking about the future and everything you do because you're missing the gift of the present moment. And to not appreciate every moment of your life, and then you string them together and that becomes your life, your narrative, was a hard thing to learn because, I was a guy that rehearsed with my staff before a meeting what the results should be in the meeting. And if we didn't do that, we'd be upset with each other, and it was ridiculous. Once I stopped planning, once I started adopting uncertainty as a principle and not needing the certainty of every day and what it was going to mean, it was so liberating and free that I kind of became a unicorn in that we're rooted in the world of healthcare and the logical path that people like us follow if we're not doctors. We're all around the edges. We're creating the next great thing, etc. But it gave me the ability to look in a way that a you're you're not any different than I am, whoever you are.
Hmm.
If you're the majority leader of the Senate, God bless you. You followed your path.
Sure.
I followed mine, but we're both the same people. We're really one and connected to each other in so many ways. Just like you're connected to the outdoors, and this is in Deepak's book a lot, is the idea of connecting with nature as a spiritual guide.
Hmm.
So mindfulness I learned later in my life, Rex, and mindfulness, is rooted in daily practices that allow you to function in an example like this. You're let's say you're presenting or you have a big job interview. You're going to go for being whatever you are to the next big thing, and it's a big company. And you get a phone call as you're walking into the office, and it's your significant other or your mom or whoever it might be,
Hmm.
and they're going, "Oh my God, Rex, Johnny's in the hospital. I gotta go." And you go, "Okay, I gotta do this thing. I know I gotta be there, but as soon as I can, I'll be there. Hold down the fort for a moment." Now you're totally freaking out, but you know you can't not go to this interview or this meeting, whatever it might be. So if you just have a practice that, and I've done this several times, um, a breathing practice where
Yeah.
easiest one is called box breathing.
Hmm.
And even in the Navy SEAL program, they teach this because you can get out of control really quick, right? So in that case, you just position yourself and you take a breath, inhale on the count of 4, you hold it for 4, you release it for 4, then you hold the release for 4, and then you inhale again and do that 2 or 3 times. And you can do that in a minute. And I guarantee you'll be calm, more relaxed, and more grounded to be you, to go and do the best you can in that meeting, and then finish. Everybody's happy, and you scoot off to meet your person and take care of the problem.
Right.
And I've
It
done that 100 times.
it's I've done at times in my life. I've been better at doing the breathing exercises in the last couple of months, and part of it is picking your book up. Part of it is, I think the universe just kind of, when you need a message, the universe is not very subtle, not very quiet about giving you that message sometimes, right? Like, I feel like it's given me that message a lot. I read another book called, I think, Smart Conflict recently, that even, when you're approaching a meeting where there's going to be tension, like doing that breathing, and they talked about the box breathing right before you go into that meeting. But even things like that can help you ground, help you be so much more present, so much more calm, so much less reactive in that conversation, and just make the outcome so much better. And I can imagine, yeah, in DC with some of the meetings you were going into, how helpful that was in doing that.
Absolutely. And everybody in DC is pretty much an aggressive type A personality.
Sure. Yeah.
And,
Yeah.
it could be a staffer of a trade association where you're coming in for a hill visit on a fly-in. So people fly in from all over the country. Doctors love to do this. They come in their white coat and we send them to congressional offices. They talk about healthcare and whatever the issue might be, and then they go from meeting to meeting to meeting, and then you have dinner with them and then fly them out the next day. So very normal, typical
Yeah.
thing you do in Washington. But everybody feels like there's a right way to do something, but there's no right way to do anything. It's whatever is works for you, what's comfortable for you. And the thing about getting older, which is so wonderful, is the aging process creates a wisdom that is really hard to teach. And the part of you asked me before about writing the book, that was a real motivator for me to work really hard to write a book that would transcend the role you were in and be a life lesson and learning.
Yeah.
Because when you think about it, there was a book called Zen and the Art of Motorcycle Maintenance
Right.
when I was maybe in college,
Mm-hmm.
maybe even before. I don't remember exactly when, but that book had very little to do with motorcycle maintenance,
Right.
but the dad and the son traveled the country on motorcycles and experienced the nature and the wonderment of living together every day in the adventure of that experience. And it stayed with me for a very long time. And when I wanted to contextualize the book and say, what would this be? What would it look like? That was a really helpful way for me to frame
Sure.
it. So it really could be, it is the Zen Lobbyist, a transformational approach to healthcare and all that.
Mm-hmm.
But it could have been, as my oldest son would say to me, Dad, it could be the Zen um, talent agent, which he is in Hollywood, and he lives a crazy life as well.
Uh-huh.
Or it could be the Zen plumber. It's really incorporating the principles that you talk about so nicely in the book into one's everyday vocation
Whatever you do.
or in
Mm-hmm.
everyone's life.
Yeah. Yeah.
And that's, to me, is really what the message of the book is.
Yeah. Yeah. Yeah, it's such a good message. The and the way you apply it to your vision too, right? Which I was impressed with how you articulated this. And you say, this is what you say, at least in one part of the book, where you say, here's your vision. Every American has accessible, affordable, and accountable primary care delivered through a PCP-led team, a dream team made up of family physicians, nurse practitioners, physician assistants, mental health therapists, pharmacists, nurses, community navigators, home care services, nutritionists, yoga practitioners, meditation instructors, and other skilled care providers supported by an analytics group. So I think that's such an ideal vision. Can we get RFK Jr. to put that next to the new pyramid, the new food pyramid we have? Like that, can that be part of it too? Part of the Make America Healthy Again?
I think if you look at the Centers for Medicare and Medicaid Innovation, CMMI,
Yeah.
their latest model that moves away from ACO Reach to ACO Lead is trying to do that. The people in CMMI leadership right now, led by Abe Sutton
Mm-hmm.
and Gary Batchelor, are trying to move us in a direction where primary care led teams receive a population health type payment and they share in savings related to management of the conditions of the population that they're accountable for. So I think that this can be achievable during an RFK time in office. And this seems to transcend Democrat or Republican
Mm-hmm.
because it seems that when you look back at the Affordable Care Act, and I won't go through the whole thing,
Mm-hmm.
I was once in a conversation like this, and the guy said to me, Gary, you're like Forrest Gump. You've been at every sentinel event in healthcare in the last 50 years or 40 years. I said, you know what, Anthony? I was,
Mm-hmm.
and it just was where I was in my life, how it worked out. And I can cite chapter and verse that I can remember, thank God, that of all these events that happened and what I was doing in that moment of time and how I was impacted or how I advocated to advance it forward. So my vision was very consistent. And if you look, you remember in the book, I talk a lot about my primary care doctor growing up
Yeah.
and how he cared for my entire family.
Right.
It's funny, but one of my very dear friends is still in contact with the kids who are my age, our age, whatever,
Uh-huh.
of Dr. Ehrlich, who I talk about in the book.
Uh-huh.
And two of them are docs, I believe. And he said, "Do you mind if I give them your contact information?" Because when I talked to them about it, they really thought it was a testament to their dad, and they never appreciated their dad in that way or remember him in that way. But for some reason, it was a lasting impression on me because, I mean, think about it. If somebody was sick in our family, Dr. Ehrlich would come to our house and he would manage our prescriptions, make sure the pharmacy knew exactly what we were doing, getting, um, manage our referrals to specialists. He wasn't paid an extra amount of money to do
Right,
that.
right.
It was just what he did. And I grew up in a New York suburb of New York City, so it wasn't like I was in a little town in rural America somewhere. I mean, this was suburban healthcare the way that I grew up. So if we could redo this on a big scale to America by empowering primary care led teams to manage our overall health and well-being, I think we're going to be much better off in general than the disparate transactional based fee for service we live in today.
Yeah. Yeah. When, we work with a lot of health plans, right? And their provider partners and they're those provider groups that are most effective at managing every aspect of the triple aim and then some are the ones that have that team concept, right? We hear about it over and over where the patient goes in, they received a pre-visit outreach asking about some of the other questions that they might not get into in the visit, but then when they get there they spend a few minutes with a pharmacist, a few minutes maybe with a different people, some kind of community advocate, navigator, and then the PCP, nurse, like they see different people in this team concept. So it definitely, I love I think your vision is definitely where we need to head to. You talk a lot about value-based care too, and quickly on this, the you show that the AMA says that value-based care is designed to focus on 5 key goals. So it's the triple aim, right? It's the patient experience, health outcomes, and cost. But then there are 2 others in this list: advancing health equity and supporting the well-being of the healthcare workforce. I've never seen those in a value-based care definition, and I'm so intrigued by that. But are they still are value-based care plans achieving that? Are they really focused on all 5 of those things and not just the triple aim?
So I think the intent in the last administration by the creation of ACO REACH, which involved the word equity in it, was clearly the intent, and they put money where the mouth was by suggesting if we would go into underserved communities, we would get an extra bump in payment. So conceptually, that was
Okay.
laid out, and they put the carrot, and we all had to make decisions. Do we want to what level? It created the idea of a health equity plan. So I think they were on the right track if the objective was to get more coverage in underserved communities, which was clearly their agenda. There's a backstory to that as well, which another time I can tell you about.
Okay.
Um, but advancing health equity is a good overall objective for all Americans because
Sure.
if everybody is treated with the same level of respect and you looked at the world from the lens of didn't matter. My job as a doctor is to take care of you regardless who you are, how much it costs, etc. That isn't Pollyannish. That really, if you're going to live in a world of compassion and caring and gratitude and kindness and love above all, you really need to practice equanimity in everything you do.
Mm-hmm.
And by definition, it kind of fits into the story. They jerry-rigged it in the last CMMI models in the Biden administration to really try to make it work. And their intent, I think, was good, but it wasn't enough. There could have been a lot more. But I looked from the lens of equity for all, everybody in this
Yeah.
country, and it should be on a fair and equal basis. I know, Rex, in New Jersey, if you're a woman of color, your access to good obstetrical care isn't even in New Jersey, which is a very progressive state,
Hmm.
um, is like 49th in Medicaid in the country, something like that.
Yeah.
And they're not getting the level of care that women, that white women are getting, and that's
Hmm.
just not right. And the doctors are upset about it too, but it's just what happened in New Jersey for a variety of reasons. So things like that, I think, have to change,
Yeah.
and primary care has to lead by example, because primary care can holistically look at a patient, manage them over a longitudinal period of time, and have a team around them to support your wellness as well as your chronic conditions. I live in that right now. I have in Northern Virginia, it's hard to get a primary care doctor, but we have concierge doctors all over the place.
Hmm.
So if you're willing to pay a little more, which my wife and I were, um, we get exceptional primary care and kind of a version of this team we're talking about,
Yeah.
at least in the network.
Yeah.
So I do believe this can be the way care in this country is delivered and designed. I will tell you that I highlighted it very specifically because payment reform alone is not going to do it. Medicare for all, a lot of people have talked about.
Hmm.
To me, that's a slogan. It sounds good because it's a payment, but it's only a payment mechanism and it does nothing to systemically motivate behavioral change in providers or hospital systems who thrive in fee for service and thrive in transaction based care. I want to remove the incentive of transactions to say you're getting a pool of money, manage the patient, keep them healthy, and help them manage their chronic conditions. And let's go about our lives. And
And
I
help. Yeah.
believe
And
that can be
help
done.
and help everyone flourish. Yeah. No, I
Right.
love that. Um, I know we're at the end. I need to let's jump to some rapid fire questions. Some
Okay.
all right,
It's
just
fun
a
to
few.
talk to you about. I will be honest.
All right.
Good catching up.
So for sure. What's one book everyone should read?
I think we said it before. I'd start with Seven Spiritual Laws of Success, it's called, by Deepak Chopra. It was written when he was beginning his move from medicine directly to um, medicine plus spirituality. And it's still a book I read pretty much at least once a week. I'm touching a part of it.
Mm-hmm. Wow. What's your most helpful personal failure?
Losing everything and then have to rebuilding, because once you've had it and lose it, you're going to build with purpose, you're going to build intentionally, and you're going to build more courageously and more authentically. So I made some silly
Mm-hmm.
I was very fortunate back in the day, and started a health plan which was called an HMO in those days.
Mm-hmm.
The federal funding dried up and it was bought by an investment led group, and I landed up with more money than I should have because I was a social entrepreneur. I wasn't a focused business guy making investments and trying to do that. Naive to me, but here I am in Fort Lauderdale with now a nice account, and people misled me really quickly to invest in this and to do that. And I was on the verge of losing everything I had gained and all the status that came with that and all the things that make you feel really good about I'm successful.
Yeah.
But that's really not success. It's not really who you are. That's fleeting. So to me, I woke up and I said, oh my God, I may have lost all of this, but you know what? I can do this again now that I understood it,
Yeah.
and I can do it with focus, purpose, intent, and care for people in the middle of it.
Right. Love that. Yeah. What's a belief you swear by?
Vision without execution is hallucination.
Okay.
Remember that? But it's so true.
Yeah. For sure.
Because if you envision and you're an innovator and you create something and you can't execute against it, which many people that are the initial developers can't run anything, you're going to fail. And if you really want success, you've got to have the right people that can execute around you.
Yeah. Yeah.
Richard Barish taught me that a long time ago. Shout out to Richard.
Sure. Okay. And then last question, how would you finish this sentence? For me, one of the most important ways to human up is to
Be present.
be present.
Be present. And look at presence as a gift.
Yeah. Well, I'm glad you were present today, Gary. I enjoyed this a lot. So good to catch up with you, and let's do it again soon. So congrats on the book. Thanks for all the insights, and thanks so much for being on. Great to have you.
Thanks, Rex. It was really a joy to do this. People should be joyful, loving, and care for each other and not fear. Don't live in fear. Don't be afraid. Be strong, be courageous, be bold, and we'll get through all this.
100%. All right. Thanks, Gary. Thanks, everyone. We will talk next time.
Take care.